This program is proudly brought to you by Telecom Limited and Daytech.
In this session of Infocus, we are joined by Ms. Jane Hooker and Dr. Noah Tapua, both who are from the Operation Open Hearth Foundation. We discuss the prevalence of heart diseases in Papua New Guinea and the work the Operation Open Heart Foundation is doing in Papua New Guinea. Dr. Noah Tapua and Ms. Jane Hooker, thank you for joining us.
Thank you for having us. It's a pleasure.
Thank you.
Firstly, Jane, could you tell us a little about the Operation Open Heart Foundation?
Operation Open Heart Foundation is one of the successful impact health projects in the country. We're an NGO that has been in existence for 33 years with the objective of providing life-saving cardiac surgery to Papua New Guineans who cannot afford to go overseas, and also to train local heart surgeons, doctors, anesthetists, and nurses so they can deliver the services in the country.
Now, Dr. Tapua, based on the latest statistics on heart diseases in Papua New Guinea, what is the trend like?
Well, the trend is deeply concerning. The first recorded heart coronary artery disease was recorded in 1964. And ever since, up until now, we've seen a steady increase. For example, in 2021, a total of 15,800 deaths. And this, if you look at the age standardized mortality rate, it puts it at 365 per 100,000. That places PNG among the highest country globally. And the driving factors are high rates of high blood pressure, tobacco, limited access to early diagnosis. For example, 26% of adults have been shown to have high blood pressure, and smoking prevalence remains close to 30%. What's more alarming is that the annual rate of heart diseases that we see from 1990 to now has increased by 20%. And that needs a national action plan to address this issue.
Are there specific heart diseases that are much prevalent in Papua New Guinea?
Heart disease, you can divide them into congenital, infective, and lifestyle. All right. So congenital is about 8 per 1,000, and that is constant in any countries. As long as you have a producing population, you will have that the constant 8 per 1,000 of children born with congenital heart disease. Then you have infective, like rheumatic heart disease. And now what we are seeing is lifestyle, like coronary artery disease, patient coming in with heart attacks. So that's an alarming trend now in Papua New Guinea. And high blood pressure plus diabetes, they are all compounding factors.
Are there specific warning signs that people should be aware of that maybe symptoms of possible heart diseases or heart problems?
Yes, for adult, if the patient present we are suspecting with coronary artery disease is especially with chest pain, and that chest pain is is described as a impending doom, meaning that you feel like you want to die. This crushing pain, sometimes it radiates to the left upper arm, or it can go to the back of the chest, and the frequency of it increases. So, for example, the patient will first say, I felt the pain every 15 minutes, and then it increased to every 10 minutes, and then 5 minutes, you know. So those are some of the symptoms. Shortness of breath. Patients will, with a heart problem, when the heart starts to fail, they will start to have shortness of breath. Also, maybe swelling of the limbs or the abdomen, because the heart is a pump, and when it cannot pump the blood out, then there is pulling in the heart so that it has to seep out into the third space, we call it. So those are some of the things that the patient present.
How important are lifestyle changes in reducing the risk of heart diseases?
It is very important. Preventive, as we know in medicine, preventive is better than cure. So how we control what we put in on our mouth, and it's very important. It's indeed a thing that we advocate in medicine, that you look after yourself now, your body will be better into the future. So garden food, fruits, vegetables, because in them, God has already put what we call the chemicals. They protect us, and when you eat those food, garden food especially, then it protects you. They call them phytochemicals. They protect our body. And different vegetables, for example, you know the colors. When you look at why the tomato is red, why the pawpaw is yellow, why the mango is yellow. It is because of this composition of these different chemicals, the phytochemicals we call it, and they are the ones that protects us.
Now, Jane, back to the Operation Open Heart Foundation. How is it advocating for policy changes to improve heart health resources and accessibility?
Thank you. It's a very important question. Since Operation Open Heart started, we haven't been in the awareness and activist space or advocating space where we go out and do awareness campaign, and we'd like to start doing that. But we like to be in the front line of actually doing something. We like the actions and that we're taking towards saving lives to be more impactful than the policies, and we'd like the policymakers to look into areas of improving the services. But if we were given the opportunity to advocate for improving cardiac care, I think one main thing that we would request policymakers to look into is to introduce the Sugar Tax Act. Other countries have done it, and why not us? And that's what we'd like to see happen for PNG to improve. If we'd like to see a healthy country and see a reduction in sugar-related diseases like cardiac disease, and I'm sure Dr. Tapa will agree with me that most of the diseases that we have are related to high consumption of sugar. So yeah, we'd really push for that Sugar Act tax to be introduced in Papua New Guinea.
Would you say that's a viable option to pursue?
Oh yes, it is, because many times we say it's individual choice, but the impact is to come through the policy to roll out some of these health measures that individual needs to take.
Thank you, Dr. Tapau. We now go for a quick break. Join us on the other side for more discussions. Welcome back. You're watching In Focus. Now, Jane, the foundation, which is the Operation Open Heart Foundation, it's known for bringing in volunteer surgeons, nurses, and other medical personnel to perform operations. You've recently had the pediatric cardiac screening program at Ley in Morobe province. Are there plans to run similar programs around the country in the near future?
Yeah, absolutely. This program started last year. Before COVID, there was a screening program going on. And then after COVID, we stopped doing the program because we didn't have this portable ultrasound machine. And when we received that machine last year from BSP's generous donation, that enabled our pediatric doctors to start flying to the provinces and carry out the cardiac screening for children with congenital heart disease and rheumatic heart disease. So we've did 13 provinces last year, and we didn't complete it because of the peak period in October and November, December. So when we started this year, those provinces we didn't do last year, we prioritized them and we got them out of the way. So far this year we've done 11 provinces and we got 6 more to go. So After Ley would be Hela province and the remaining provinces, Mount Hagen, Medan, Rabaul, and another province. 50 children were screened in Ley, 50 plus. And I want to say thank you to the Ley International Hotel. They supported us with accommodation. So these are the support that we get to the screening, and with Air Niugini providing the airline tickets to our doctors. And in addition to that, they are also giving free tickets to children that are diagnosed to undergo surgery here at Port Moresby General Hospital, the closed heart surgery. And New Guinea gives a ticket to the patient and the guardian to fly over to Port Moresby and undergo surgery. And that's the surgery that Dr. Tapawa and his team can do locally here at the Port Moresby General Hospital.
Doctor, could you just highlight in a nutshell what sort of surgery, what entails in this surgery?
Yeah, so surgery itself involves what we call a closed heart operation. So when the team goes out, they identify these children who need surgery. So when they come to us, and they see about almost up to 600 plus overall. And from that screening, we further screen them down and who actually need surgery. So when they come, when they arrive at Port Moresby General Hospital, we admit them, do the workup, and we do the operations. Operations, like I said, is a closed heart operation, and many of these children, they have an abnormal connection with the major vessel that supply the body. This connection should close as soon as the baby is born, but for some reason, some of the children, it doesn't close. So in Port Moresby General Hospital, we can also now do device closure for some of them. That's the current technique now, and the others which we cannot device close them, we do the operation and close them. And these are the children that have a very large duct that you cannot close it percutaneously.
Now, Dr. Tapawa, a crucial aspect of the Operation Open Heart Foundation is that it facilitates the transfer of knowledge and skills to local PNG medical professions, particularly from visiting medical professionals from overseas. Could you tell us about the capacity building initiatives that you are currently running?
Yeah, so with the assistance of the Operation Open Heart, over the 33 years now, since 1992, there's a tremendous change, even though it took us a long time. And the aim of the mission initially was post-service. And then later part of the program, we said, no, we have to start training our own locals. So that's when we started forming a team. So we've got a core team by 2015. And some of those team members, including myself, we went out for training, and through also support from the Operation Heart Foundation and other stakeholders. And we all came back in 2015, and then we started this program. So we've now have a good team, and we've been doing the close out operations since 2026, yeah. And up until now, we've been doing that, and that includes the implantation of the pacemakers. These are patients who have heart blocks, and recently we've started doing open heart surgery as well locally. So we've got our anesthetist trained Papua New Guinean. We've got myself and the other candidate, the other surgeon now is in Australia, doing specifically pediatric. These are children. We've also have the perfusionist who runs the machine, and the nurses. The nurses is the specialist that we really need post-op and even pre-op as well to look after our patients. And we've got a good team now. We started off with, say, 15 nurses, and now we have over 60. So the capacity building through this program has assisted a lot.
Thank you, Dr. Tapau. We'll go for a quick break. Join us on the other side for more discussions. Welcome back. You're watching In Focus. Now, Jane, how critical have partnerships been for the Hearth Foundation? I understand you recently mentioned that New Guinea facilitated the travel of several of your patients from the Hela province.
Yes. The recent support that New Guinea provided to 2 children who were screened last year during our screening program and found 2 children from the same parents. One had an issue that required open heart surgery and the other one for a closed heart surgery. So we reached out to New Guinea and they generously provided airline tickets for a parent to come with the 2 siblings to Port Moresby, and it was during the week of the Singapore pediatric heart specialist team visit, in order that the other brother could undergo his surgery and the other brother would undergo the closed heart surgery. So yeah, that support from New Guinea was a very timely support, although they were only supporting children that required closed heart surgery, but when we asked them that there was a sibling that required open heart, that if they could assist, then they were happy to do it because they were both brothers, and saving them was, it's a remarkable story, saving 2 brothers in the same family, siblings. Yeah. But we're very grateful for the support that we receive from our long-standing partners like BSP, ExxonMobil, PNG recently coming on board. But over time, it has been BSP and the Sir Brian Bell Foundation and More Printing, who's helped to print our publications, and Ella Motors, who supported us logistically to run our program, Open Heart international visits successfully. And we're very grateful for the support that they give to us. And we would like to see more support in this area because we've got more children waiting for life-saving surgery.
Now, Jane, in terms of community engagement, how can individuals support or get involved with the Foundation's initiatives to promote heart health in their communities?
Thank you. One good example of that is the Valley Hunters Rugby Union Club, who approached us and said, hey, look, we've heard about what your foundation is doing and we'd like to be involved. And we asked, look, how would you like to be involved? Said, we'd like to do a gala dinner to raise funds for children that need, in need of heart surgery. So that resulted in the gala dinner that we had that was well attended and well supported by everyone that came that night to give us the support. And yeah, we're grateful. So, people just want to support us. We need to do this. It's all about saving our children so they can contribute tomorrow. That's the tagline that we're using. We save them today so they can contribute tomorrow. So 33 children from last year, 25, and the number could potentially increase by the screening that we're already doing this year. So there's a huge burden on us now to start looking for funds to save this number of children that have been identified with heart surgery, because many of them may not live to see their 18th birthday. We need to save them now. So we need whatever support that needs to come to us. The 250, now 300,000 annual charity grant that we receive is not enough. People can come on board and support, voluntary support. We need volunteers who can come and give their time and say, this is what we can do. Others can do, storytelling. We're trying to launch a Heartbeat Heroes campaign where we are now slowly building a database of former heart patients, the current ones, and those that have already progressed after receiving our life-saving surgery. They are now progressing, and some of them are in top positions in the country. They could come on board and say, hey, look, how can I share the story about my having this surgery? I can tell my story so others can feel inspired to come on board and support this fantastic program. I wouldn't be doing this if I didn't have the passion to save lives. So this is a life-saving, and it's also a compassionate mission to want to save children who have a future ahead of them. So we need all the support we can get, whether it's from a sporting, team like the Valley Hunters, or just individuals coming up and saying, how can we help? But financially, yes, we do need a lot of help from our corporate, partners, our public, the government perhaps, to come on board and support this. It would be fantastic to see all those 33 children receive their life-saving surgery by next year, I hope.
Now, finally, Dr. Tapua, we're currently on the cusp of celebrating PNG's 50th independence anniversary. What is your advice to Papua New Guineans regarding protecting their heart health?
Yeah, I think basically looking after your body, and for mothers, it's very important as well, because here you have an unborn child, so whatever happens to that child, the heart, for example, what they put into their body, yeah? Because it eventually goes across the baby itself. So what I'm talking about is the mother protecting them from infection, and also what they take. For example, drugs can also affect the fetus, what they eat, and eating a lot of sugary food and things like alcohol, drugs, and smoking, in the mother who is pregnant. And for people, the adults, looking after your diet is very important, and basic things like adequate rest, because stress in itself does have an impact on the heart itself. If the person is not having adequate rest, can affect him. And if people have those symptoms like cough, shortness of breath, start noticing swelling on the part of the body, like the lower limb or abdomen, I think they should seek medical treatment. And for patients who are heart patients, they need to regularly go for checkups and follow-up, and they must not discontinue their treatment. I think that's one of the advice that we would advocate.
Dr. Noah Tapua and Ms. Jane Hooker, thank you for joining us.
Our pleasure.
Thank you.
Well, viewers, that's all the time we have for this edition of Infocus. Do join us again next week, Monday, on our regular time slot of 7 p.m. Till then, bye for now.
This program was proudly brought to you by Telecom Limited and Daytech.